looking at the Gauteng economy, looking at the national economic interventions, and what can we do specifically in Gauteng. We are the economic hub of South Africa. We will also look at the pillar that looks at social mobilization and human solidarity. This is extremely important to deal with the pandemic of this nature. It has such significant social implications. It can't just be the work of government alone. We've got to mobilize various sectors of society to work with us on that. So we will continue to give you updates on what are the other sectors that are doing work with us, especially to get people to comply with social distancing. It's not something you can send the army to police, social distancing. It must be something cultivated into the consciousness of our people. Hygiene measures, you can't send the army and the police to police hygiene measures. It must be something that is about part of the culture change. So social mobilization is also about changing, shifting consciousness of our people in workplaces, in schools, in households, in many public places as well. To change the consciousness of our people, to cultivate these measures that have been imposed upon us, and some of them have to become the new normal. We will conclude by looking at law enforcement and compliance in the new phase. Level 4, we'll share with you what our plans are in that regard. An introductory note, many of you who were able to follow us when we spoke at the State of the Province address in February, on the 25th of February at Sefako Makhatu University, when we were launching our plan of action, Growing Gauteng Together, we identified what we call the Megatrends, the major driving forces that every part of the world, society, states, economies, every part of the world is looking at that, and futurists have sketched what are the major driving forces that will shape the world, that will shape the future. And you will recall that we also embraced the scenarios of indulamity and identified the scenario we want to pursue to build a better province that is inclusive of all. But I want to say that those driving forces which we identified, which we sketch here, demographic shifts, the demographic shifts are happening in many parts of the world, younger populations, aging populations, many other dynamics. We said those shifts will have an impact on the world. Rapid technological change, we identified that, what others call the fourth industrial revolution or digital transformation. Everybody knows that the digital revolution is a key driving force for change. It's reshaping the way we live. Increasing levels of urbanization and rising inequality, we identified those. They are not just the problem of localities, villages in South Africa or informal settlements or township in Gauteng. Rapid urbanization is a big driver of the way things will look like in many parts of the world, especially in the south, where global populations are concentrated. In Africa, Africa is going to be a key driver of urbanization. Most of urbanization is going to happen in sub-Saharan Africa. And all this has implications on everything we have been doing. Rising inequalities, COVID-19 has exposed inequality as a real sore point. And climate change. So this we sketched out, but we need to say now we want to add pandemics. That pandemics, as COVID-19 has shown, and COVID-19 is going to change the way, it's going to be one of the key driving forces about the way the world will look like, workplaces, the way states will function, the way people will live. It was understated that this is pandemics, the outbreak of pandemics is a very key disruptor. It's a major disruptor, and it's a significant existential threat that warrants not just national planning and national coordination, but it warrants global coordination. In the past pandemics that would break like an epidemics would have been seen as problems of developing nations and poor countries, Ebola in Africa. You would have other pandemics that would affect countries that have weak public health systems. But COVID-19 is impacting on almost every country. So it is something that needs to be looked at quite seriously, not just in the next 3 months because it poses the immediate threat. In the next many years, the last pandemic, epidemiologists say that the last biggest pandemic, and historians and economists agree there, was the 1918 Spanish flu. But COVID-19 is a huge, huge game changer. So basically we say that our plan, Growing Gauteng Together, is being re-looked at in the context of COVID-19, and we believe that all our plans as a nation, including the NDP, and all the plans we have for this decade, 2020 to 2030, the globe, the UN's SDGs. I mean, public health is an important issue in there, in the SDGs, but this pandemic just shows that it has to occupy a much, much bigger space, because when there's an outbreak of a pandemic, as we have seen with the coronavirus, it can disrupt even the same nations that would have thought they are much more secure. In that. So that's how we frame the comprehensive response. And we basically agree as the Gauteng Provincial Command Council that we've got to plan our government system, and our system of government has to be enriched to can withstand, to be resilient, to can withstand any future pandemic. How we're going to do that is going to be a big mountain to climb. Our municipalities are dealing with huge socio-economic fault lines, poverty, inequality, inadequate access to services, backlogs in infrastructure, but also institutional weaknesses. We've got to use this opportunity to reimagine the state, build the capacity of the state, not just like a rhetorical thing, but the ability of the state to respond to outbreaks of pandemics and other climate change related disasters. I want to say to you where we are meeting today is our Provincial Command Center. The team that's dealing with this disaster meets here, integrated, very integrated. It also uses technology from all the various sections, from law enforcement agencies, including at national level, municipalities, all departments. They do lots of work on technology, on technological platforms. They engage, but sometimes some meetings are necessary, but they do social distancing. This is where the command center is. And we have never worked so well together. That's the first story of COVID-19. We have never worked so well with municipalities. We have never had such coordinated. This existential threat has forced even the most difficult people who often have to be pulled into the working together to work together. Even government departments have worked together so well. And we say this must be the new normal as well, about working together. With regard to healthcare specifically, let me come to that key pillar. Our comprehensive health response, you got the update, the nation got the update from the Minister of Health in terms of the national picture with regard to the new numbers, the new infections. Gauteng has 1,408 cases. So there is and then there's a full breakdown of the different provinces, which we watch very, very closely ourselves. I won't bore you with that. Let's look at the breakdown in Gauteng Province, the numbers as you would have them. Out of that 1,408 cases, we have 948 recoveries. That's 67%. And we have active cases being 449. That's just about, that's exactly 31%. And we've got 11 recorded deaths. And I would like to take this opportunity to convey our condolences to the families of the deceased. Yesterday in particular, Gauteng had 3 deaths announced. Those deaths have happened over 2 days. And I want to report that what we do as the province when there is death in our hospital, we report the case to, that's the protocol. We report that this case gets reported to the national minister. There's also verification around the cause of death. And it's only once the national minister has announced those cases that we include them in our numbers. We want to breach that protocol and start an We have positive since the first case on the 5th of March have recovered. And the exact number of that is 948. I've given you that number. In our province, as I say, for a while we had 8 cases and 3 cases added yesterday to 11. So that leaves the number of active cases being 31%. So the first important point I would like to make is that slowing down the infection rate, particularly to flatten the curve, is very important. That's what everybody in the world says we should be doing. That's what the national lockdown was about. And I want to say that as Gauteng Province, we really are a province that feel that the national lockdown has had a very positive impact on slowing the infection rate. All the measures that were in the national lockdown, just from a positive point of view, it has helped us to slow down the infection rate. We think it has also a lower mortality rate. The Minister of Health was saying that in public 2 days ago. A lower mortality rate is also a positive thing, and a higher recovery rate. So when you look at those, that the daily infection rate has gone down in our province. The number of, in the last week in particular, the number of daily infections would range between 22 and up to 30. That has flattened the curve, and as that happens, the number of recoveries have been increasing on a daily basis. So it is important that as a province we say that the period of level 5 we are coming out of, because we were a province that the infection rate was just spiking up. You know, the first, when the international airport was open, especially OR Tambo, the number of people who were arriving, and every day our tracers picking up the problems and how many contacts they would have was huge. So in the last 5 weeks, we have been able to see a much lower. And this has given also our tracers an opportunity to literally trace everybody. I'm going to give a report on our the success rate in terms of tracing, because that is crucial. So I want to, this graph basically gives you a sense, the point I was making, the relationship between positive cases, recoveries, active cases, and mortality, death. So you will see the blue graph there, it's the curve. So that, looking at the Gauteng curve in between the 23rd of March and the 26th of April, we just excluded a few days, 2 days from there, you would see that the curve from the beginning, we were dealing with the infection rate that was really, really huge. There was a period where we were getting 207 infections a day, and up to 300 infections a day. So now we have been able to stabilize. The curve is flat. And look at the graph that deals with the number of recoveries. So our recoveries have been shooting up. That is what we want, essentially. So the rate of infections, we wouldn't like the rate of infections to be shooting up, that the graph is steep. That the curve is steep. We would like to see the recoveries being the ones that are happening much faster. And you will see the number of active cases is also falling there. And again, that graph, those three graphs, an increase in the number of recoveries, the graph going up, and the decline in the number of active cases, that graph going down, and kind of a steady increase. Yes, infections are still happening, but the number of infections have been fewer. It's a function of a number of things that I'm going to share with you that our team is dealing with, our public health officials are confronting in a very, very big way. This graph gives you the same story. The next graph gives you the same story, but this slide is really about this bars. It's the same story. How many infections do we have? Positive cases do we have? How many recoveries do we have? And how many active cases do we have? That's where you will see the recoveries. The number of recoveries are higher and the active cases are fewer. And then particularly death, the number of deaths are much, much fewer compared to the number of active cases. We're not comparing ourselves with any province. COVID-19 is a painful pandemic that impacts on our people's lives. Infections anywhere in our country, anywhere in the continent, and anywhere in the world, it's a human disaster. Death is a human disaster. But we are continuing to just map the data about the trajectory. The important thing about this is to give us the sense of the trajectory of the pandemic in our province at the stage where we are now. And so that's what we are doing. We are tracking as the numbers are coming out. We are tracking to, and we do this. We use this data also to inform our tracers and other decisions, to plan the model that we are using to do new infrastructure, to plan for quarantines, to plan for new beds. That's why we use this data. We also share with you today the breakdown of the regional picture with regard to the positive cases, the active cases, recoveries, and the mortality rate. You'll see that at least so far, Ekurhuleni, and the Ekurhuleni one happened in the last week. Ekurhuleni had much greater recoveries, 71% of the recoveries in Ekurhuleni. Johannesburg, 67% of the recoveries. But as you know, Johannesburg, the numbers are huge That's the region, the district, the metro that was hardest hit. At the beginning of March, from the 5th of March, so there was a period where 70% of all cases in Gauteng were happening in Johannesburg. So even in Johannesburg, the infection rate has slowed down, and we had seen Ekurhuleni having more infections. That's why in the past 2 weeks, Ekurhuleni had more infections. The numbers have gone up. That's why we are monitoring the recovery rate there. We are interested in that to see, so how many people should our public health system still be worried about, who need to be monitored, who need to be supported in one way or the other. Tshwane, the recovery rate there is 66%. Sedibeng has a lower recovery rate because it has a low infection rate. That's 15 people in total. We have had 15 cases in Sedibeng. Out of that 15, you'd see that 33% is 5 people. In numerical terms, 5 is a lot, but in ratios, it's a very small a small number compared to the others. So that in total gives you what the Gauteng recovery rate is. We also show the mortality rate region by region. The region that has the highest mortality rate in our province, there are 2 regions, is Johannesburg at 0.7% and Tshwane at 0.7%. Ekurhuleni has a lower mortality rate of 0.6% amongst the metros. But Sedibeng has actually, Sedibeng has there's no death. So in that sense, they have a zero mortality rate, 0% mortality rate. Again, we're sharing with you what is important: recoveries, death. If you look at the breakdown of the active cases in our regions, so you would see that Johannesburg, which had a load of positive cases, has a huge number of recoveries in numerical terms, and the number of active cases are 279, much fewer. Ekurhuleni story, I explained to you that just in the last week we had a significant improvements in recoveries there. There's only 92 people who are still positive there. Tshwane has been very stable. The important thing is that there was a period where Tshwane, between the airport, that's OR Tambo International Airport, what Dr. Masuku says, they call this the triangle. So there were lots of, in the early cases of infections, a lot of cases would be essentially from the airport to our seat of government. We had more cases at the beginning there together with Johannesburg and portions of Ekurhuleni. But the infection rate in Tshwane has been very, very stable so far. And they have a fewer number of cases in that regard. We must say that with regard to the mortality rate, we were concerned. There are several deaths that occurred in the West Rand. The West Rand has a lower population in our province. Some of the early indications about the number of deaths that had happened in the West Rand worried us a lot. It is a matter that our team of public health professionals have been looking at about where those cases have happened, including in some of the facilities that we got worried about whether those, especially private health facilities, and it's a matter that Dr. Masuku is dealing with very, very closely with Professor Lukele, our head of Department of Health. So if that is the picture with regard to positive cases, active cases, recoveries, and mortality, the next story we want to share with you is around the contacts. Because the issue of tracing of contacts is very, very, very important. That's the only way you can get a full picture of the threat ahead of you, together with tracing contacts and testing more people and screening. you have a real sense of what is it you are not seeing. Whilst it is important that you must be concerned about positive trends on recoveries and the mortality rate being low, you must also be concerned about how many people may have interacted with those who are positive, so that you are not caught by surprise by a sudden spike in the numbers. And where are they located? In which area of the province are they located? And what's the risk in those areas that they can infect more people at one go? So that's what our contact tracing teams have basically been doing. And so firstly, you would see that the full contacts that we have in Gauteng is 8,353. These are the people that our teams, so out of the 1,408 positive cases at each given point, we have been able to trace that those people who would have interacted with another 8,000, a total of 8,353 other people. But this is over a period of time. So, and those you know what we do with contacts. The contacts, the first important thing is to ensure that those contacts don't, should they be positive, they don't infect others. So if they are not in, if they are not in self-isolation or self-quarantine, they have to be put into our quarantine facilities. So we have some. We'll show you later in this presentation how many people we have had in quarantine facilities. But the good story, out of this 8,353, there are 5,803 people who were discharged from being contacts that could spread the infections. And what does discharge mean? It means they've been subjected to a process of monitoring, including that there are those that are quarantined over a period that's 14 days. And after that period, even in that process, they've also been tested to be sure. And when they are subjected to that process, they've been tested, they have not just screened, tested, they've been quarantined. When the period of quarantine ends, they get discharged into society. In other words, they are free. So that's a significant development for us which leaves 2,517 contacts that are being monitored. So the others are no longer a big worry. So the 2,517 are monitored. So every day when we get new numbers, you know, when the new results are coming that we've got so many positive cases, they get added into the number. So the number of 2,517 essentially moves up and down every day. So when we take out those that have now completed the monitoring period, and our public health officials are saying these ones are okay, we subtract them and release them, and then every day we add those new cases that are come, so that there is proper surveillance and monitoring of the contacts at all times. Our contact tracing. So contact tracing is a very important thing in this battle against COVID. If you have too many contacts who are out of sight and you don't know exactly where they may be and what they may be doing, you run the risk of huge bushfires turning into a really, really big storm that raises down the whole province. So our contact tracing has improved quite significantly, and we give you statistics with regard to new cases in particular. We are at 94% of contact tracing. So yes, there's always a certain number of people, and we are a province that's extremely dynamic. At least under the lockdown, people can move in and out of the province. But we lost some of the contacts. And some of the people who left the province just before the national lockdown happened and went to their home provinces. But it is very important that this is where we are now. We are sharing with you this information about contacts. The situation may not be the same as we move forward, and when we conclude this section on health, we'll share with you what our big concerns are and what are we watching closely. The next thing we want to share with you is the screenings. Now, screening is extremely important. We have screened 1.3 million people, and out of those we have been able to test. I'll talk about testing in the next slide. We have been able to test 17,000 and a couple of people. Screening is something we want to enhance quite significantly. It has helped us a lot to give us a sense, but we know there's new data. The new data that the scientists have thrown into the discourse, and that data is that 50% of people who may have contracted COVID-19 may not have symptoms. So as you know, screening is about checking symptoms. Do you have this symptom? And then you get tested. Now, if the scientists are saying that there's new data they are checking, that the possibility exists that there may be many people there. 50% of people who are COVID positive may not have symptoms, but they may be going around normally infecting others. So you would have, once that comes to the fore, you have to revise what you are doing. That screening is important, and I just want to say to you that we want to screen 5 million people in Gauteng over the next, in the flu season. We are entering the flu season now, May, June, July. We want to screen 5 million people. We'll continue to do screening. But you'll hear what I'll say when I talk about testing and what we're also doing in addition to screening and testing. What are we doing to deal with the challenge of the flu season, about the flu vaccination? I'll show you the numbers that we have done so far just in this month. So screening we will do. It's important. At least those who have symptoms, we're able to refer them for testing. But we don't want to rely only on screening anymore, given the changing dynamics of this pandemic, according to scientists. So I've shared with you the point about screening. Let me deal with testing. The 17,942 people who have been tested in our facilities, most of them at community level. The point we have tested 1.3% of the people who came out of our screening process in the province. That is the rate of testing. Going forward, as we enter the flu season, we want to double the number of people we are testing. We want to test 3,000 people a day in Gauteng Province. And testing is also a function of a number of things, including the availability of testing kits, global value chains. There are others buying elsewhere in the world. How many test kits are available? But we have looked at a number of existing capabilities in our academic institutions, the academic laboratories. We have the advantage as a province that has university hospitals, training hospitals. Those training hospitals have got significant training capabilities, not just for training, but also the laboratories. We also want to partner with other players in the space. There are also NGOs that have capabilities for doing this work. So we want to increase our testing capability to 3,000 a day, particularly during this flu season in May, June, and July, because that's an important testing tells us what is it we don't know. So that we don't only watch what I was explaining to you earlier on, it's what we know. We don't want to only watch what we know. We must also be able to say there's something else we don't know, and we must be able to do what Professor Karim has counseled all of us to do. So we can rush to where there's a real crisis ahead of that crisis. Before the numbers just shoot up overnight or over a week, suddenly we are dealing with a big spike. We must be able to see that there may be a threat or a risk in that sector or in that area as we do more testing and screening. We also using Mpilo app, and many of you may have seen this app is extremely helpful for self-screening in particular. But Mpilo app is more useful than just self-screening. It also has information. You would be able to know what is the nearest health, particularly public health facility from where you are. You can also e-hail. You do e-hailing an ambulance through Mpilo app. Should you have a difficulty at home where you are, send a message through Mpilo app. And I want to really encourage members of the public in our province to really go to and this app, now we have given it capabilities. It's no longer just for those who have these smartphones. Even an ordinary phone, cell phone that Gogo may have to communicate with the parents and the children and grandchildren. Mpilo app is available. Just download it. It has got very useful things you can do there. As I say, it also will tell you just from where you are, should you have an emergency, what services are available from where you are. There's also reporting feedback that our public health officials are using. So I am a very big promoter of Mpilo app. This is one thing that's really is helping. There's lots of young people who are able to give us information, and we're able to advise them that even on just outside COVID-19, people have many ailments, and they may have symptoms that they don't know what the problem may be. We want to encourage this. So the other information we're sharing with you is about inpatients. So how many patients do we have in Gauteng public and private health facilities? Currently, we have 51 cases, admissions, I want to call that very precisely, 51 admissions in private health hospitals and 21 in public health hospitals. Together is 72. So the people admitted in our private and public facilities are 72. You would see that 5 of them are on ventilators. Another 5 is on oxygen. The others are on 2 on room air. And then you'd see the full total number of patients we have admitted in our public and private health facilities since the very first case is 295. So the number of people who have been in our facilities, that's public and private hospitals. And you have to get used to this notion. Even myself, I must get used. When we talk of our facilities, we are talking about both public and private. They are available for us to deal with COVID decisively. Even when we talk about beds later, we'll show you how many in private and in public and how many we are adding and ourselves. So what is it you need to watch is how many people are in hospital. So the admissions is very important, the important thing to monitor, but you also need to watch in that how many are really in a critical place. So because the cases of death often come out of that. And sometimes people get admitted in few days. They get admitted, it is possibly too late, and a few days later, some people get admitted, a few days later they have passed on, which may be, and COVID-19, our team of scientists and health specialists are saying there's a lot that the world and the scientists do not know. They are studying every case. Certain things happen. And we are happy when you have people who are in ICU and then they come out of ICU. There was a period when we had I think, Dr. Masuku, we had 12 people in ICU just on one day. There was that period. When they get out of ICU, we monitor that, and some of them really recover in an amazing way. And Dr. Masuku and Professor Lukele, our MEC and HOD visit those people quite regularly, especially when someone is in ICU. They don't leave it just to our clinicians. They take very close interest, and then on a daily basis, I get a report from Dr. Masuku about we've got a serious case, ICU case as we speak, and a situation may be developing that we might lose that life. I get that report on a day-to-day basis. But the good story is that of those people who are admitted in our hospital, you will see that a lot of them have been discharged. 186 of them have been discharged, and we lost 11 people, as I said at the beginning. May their souls rest in peace. We want to share with you the work we are doing. We are entering the flu season. Our public health workers have really been very, very busy with the flu vaccination program. So immunization per district. So you will see, so this is not a cure, because we know that there is no vaccine for COVID-19. There's no vaccine. But we took a view with the advice of our public health officials that it's important as we enter the flu season to approach this flu vaccinations in the context of the threats and risks and who is facing risk. So we have been able to vaccinate 32,381 of the staff, and this is public health workers. It's our public health workers, because the public health workers are our soldiers. They have to be ready. They have to be fit. We can't afford too many of them who are going to, as we go into the flu season, who would not be strengthened. So the immunization program, the vaccination program is important. The elderly are at risk, and it is quite clear. Everybody has heard this coming from our specialists like Professor Karim, that people who are at the age of 60 and above are at greater risk. We have also targeted the immunization, and the vaccination program has targeted that. We have immunized 34,061 children as well. We have, as you would know, during flu season, there are also children who are at risk, identified by our health officials. They do that. It's not as many as we have, because they are not at the same level of priority as the elderly. Pregnant women have also been our target. We have immunized 30,636 pregnant women as part of this intervention, to make sure that they get the boost, so that the normal flu season, it's not about whether they'll contract COVID or not. That's a different question. But to just ensure that they have the level of immunity and strength that their bodies need as we go into the flu season, to deal with flu season. We also have immunized a larger number of chronic patients, 74,016. These are patients with chronic diseases, and it's a function of this question about comorbidities. every time there's the death reported, the general trend is that those with comorbidities are at much higher risk. And this immunization program was looking at that. And people with HIV and AIDS, we have immunized 37,544. And the total number of immunization you will see there is 211,000. So we are not just chasing the enemy called COVID-19. We are also on another front ensuring that we attend in preparation for the flu season, which can become difficult. And I must tell you, our team, the Provincial Executive Council, the Provincial Command Council, our war room chaired by MEC Masuku, we are all worried about what the next 3 months as we go into the flu season would mean in terms of level of risk. That's why we had to also undertake this. The national minister has directed himself that the vaccination program will be an important intervention as an additional. As I say, it's not a vaccine for COVID. There's no vaccine. So having said that on the interventions related to health, now the next set of slides are about infrastructure, basically, getting infrastructure ready. Firstly, we shared with you last week, those who were here would know, we said in both the public and private sector, we have a total of 8,301 beds that are readily available, ready for COVID-19 at the moment. That's a combined number of beds in both the public and in the private sector. And we also give you the full numbers in both the public and the private sector of how many of those are general beds, how many are ICU and high care beds. And we have mapped also using the scenario of what is both the worst case scenario and the best case scenario. We then use this data to say, if we have so many beds that are readily available, and should we go to the worst case scenario, what is the gap? How many more beds are we going to need? And we are planning on the basis of adding another 1,700 beds, and the new additional beds will be added in the existing facilities. That's the choice we have made. Existing facilities, instead of putting too many field hospitals, we are putting this infrastructure, additional beds. This additional 1,700 beds will be added to expand our existing capacity so that we can use these beds beyond COVID. Of course, you know, at Nasrec we've got a facility there for quarantine, but we will also add at Nasrec a few beds as we prepare for a scenario that may be more than what we hope for. We will also add about 500 ICU beds at Nasrec. So for beds, hospitalization beds, that's what we are doing. This program of upgrading our infrastructure is continuing extremely well. Of course, with more funding, we can do better. And last week, I did, in front of you guys in the media, I did say to the President, we will need national support. All provinces will need national support. And we are very happy that so far, our National Minister of Health has been very, very supportive to everything we are doing, together with the Minister of Finance. Because the provinces on their own would not be able to carry this burden. It would be too huge. So in addition to the hospitalization bed, we have 5,339 beds in quarantine facilities. So separate the two all the time. Don't confuse a quarantine facility with a hospitalization facility. The beds are not the same. Beds for sleeping whilst you are waiting it's not a hospitalization bed. A hotel bed or a lodge bed It's not for people who are lying in hospital being treated. I know some people confused the beds at Nasrec, that they didn't look like hospital beds. They are not meant to be hospital beds. And we're working with national departments. You know, our province is the seat of national government. So some of these quarantine facilities are owned by or are under national departments. Others are under provincial departments. So we are working extremely well with our national departments, especially the departments like Home Affairs, Higher Education, the departments that often have difficulty in DERCO. When you have particularly tourists who would have arrived here in our country before the lockdown, about who is responsible for quarantining them. So we share this responsibility with our national department. Students who came from China were quarantined by the Department of Higher Education. So these facilities are there. That includes also private facilities. And individuals also are able to self-quarantine in hotels. That would be only open for that purpose. And that kind of work is happening. There are hotels that are open just for COVID as quarantine facilities. They can't admit people for any other thing in there. So we want to continue to increase the number of quarantine facilities. And I've explained that, in fact, at Nasrec, we will increase from the 500 we showed you last week when the president was here to 1,500 quarantine beds, and add another 500 beds there, which are hospital beds for ICU. So let me conclude the health intervention. What is our principal storyline with regards to what the numbers are telling us in Gauteng? Where is up to this point, since the lockdown, level 5 of the lockdown, is a different ball game when we are going to level 4. What's emerging from firstly, the global story is that health is not a luxury. Health is a human necessity. Health can't be something that is treated at the back burner, put there at the back burner. There will be no economy if the healthcare system collapses. Too many workers are sick. There can't be education so we can't prioritize other things and just think that health is something that we will come to, even from a funding point of view, capacity point of view. Particularly public health is something we must invest hugely in so that we can ensure that as many people, regardless of their income, regardless of their status, regardless of their wealth or otherwise, have access to health care. So the second important thing based on this is that in Gauteng this crisis gives us an opportunity to fix our public health system. We have learned from life as a Esidimeni, that tragedy, that we have to do everything to attend to every part, including things we may not see now. We are attending to all those things to ensure that there is nothing that is out of sight, including in this, ensuring that decisions are made properly. And I want to emphasize that all the issues that we are dealing with in our health response are discussed by our Provincial Executive Council. The MEC for Health reports there, and decisions are looked at collectively. The Provincial Command Council discusses issues so that every time we have to intervene, we have all been to assess the risk, the level of risk, and we leave nothing unattended in this regard. So fixing our public health system now, fixing every aspect of it, the problems associated with infrastructure. That's why we are choosing the route that we want to fix our public health, public hospitals that have problems of infrastructure, from the north of our province to the south, from the east to the west. We want to make sure we've got adequate public health, particularly at the level. We have sorted out the primary level. We think the primary health care level, we have invested substantially in that, and we are improving significantly, but we also have to turn around the actual performance of our district hospitals, our regional hospitals, and the central hospitals that at the moment are still in our care. They are national facilities, but when they are located here, they are still in our care. So infrastructure is important. Medical equipment. So one of the things we're doing, as we confront COVID, all the problems of shortage of medical equipment, or there are hospitals where medical equipment is kept somewhere else and it's been bought and is in the storeroom. We're fixing that. We're also fixing ICT to modernize our public health system. This is something we have always wanted to do. We thought we would do these things later. We are doing that now. And most importantly, the human resources. MEC Masuku has been recruiting quite substantially to get a lot of, to bring back into our public health system. He will say something regarding this incident about 800 or so of public health workers out of 72,000 public health care workers who have not been paid. And me and him have had to be very hard on this, because when public health workers are giving their best, and they are, and we thank them, there should be no incident. That it doesn't matter that the number may be small. We have to make sure all of them get paid, and he will be able to address this in the course of this briefing today. So I would like to say that we must look ahead, because the scientists are telling us that instead of thinking that COVID-19 is just going to come as one peak, there may be several waves. We may think it has come and gone, it may come back, and there are parts of the world where they're experiencing the second wave, and there may be the third wave. Instead of thinking that we're just planning for 3 months, we must internalize it. Yes, Professor Karim said the peak would come in September, but we also have to, the other scientists are saying we are going to be in this for 18 months or more. So these things we are dealing with, we are looking at revising the model. We are working with our National Department of Health. The earlier model was for a concentrated period. Now this model has to be revised to ensure that we can plan for if the wave comes and then it comes back later. We have a resilient system to be able to deal with this over a longish period of time. And for that we have to ready our public health system with infrastructure, with medical equipment, with human resources, and with the appropriate technologies that's available in the world. And we must also strengthen the interface and relationship between the private healthcare system and the public healthcare system. We are a province that's lucky. We have a lot of private health facilities in our province. They are regulated by us. But we want to enhance the interface and relationship and collaboration between us and those. And I've said some good news have to do with basically the fact that since the lockdown, the mortality rate has been low, the infection rate has been slower. We have been able to be effective in tracing contacts and even in monitoring, including discharging those that have been released back into society because they don't pose a threat anymore. And this story, going forward, this inspires us. We have also used this period to learn, because we want to agree with that the big challenge still lies ahead. So if that's good news, what is it we want to do? We want to improve in the area of screening. I've already indicated how many, and testing. We want to, particularly in the area of testing, we want to do this 3,000 tests a day and screen more than 5 million people. What is the big challenge? The big challenge is, and this worries us, is that the level 4 and the opening of the other, and we understand perfectly and agree with the decision of the National Command Center announced by the President that the country must move to level 4. There's no question about that, so that we start to deal with aspects of COVID's impact on the economy and livelihoods. We agree with that, but let's tell you what worries us. So what keeps me awake is and now the first thing is that we know Gauteng Province is a province for everybody. It's a province of people who come from across the country. At least the national borders are still closed. The airport is still closed. That makes us happy. We won't be watching the airport. But what worries us is interprovincial movement. So we have people who left this province. They work here. This is their home. But they have homes in the provinces elsewhere in the country. A lot of them, there are two provinces, KwaZulu-Natal and Limpopo. A lot of people who live and work in Gauteng come from those two provinces. And then the Eastern Cape, and then you'll have Northwest and the Free State. The smaller numbers, Mpumalanga, Northwest, Free State are our neighbors. But the largest numbers would come from Limpopo, followed by KZN and the Eastern Cape. So we know elsewhere in the world, we've also been looking that in migration, in other words, migrants inside one country, people from one region to the other, in migration has also been a key driver of the resurgence. So just when you think you have contained COVID-19, and especially when you reopen the economy, and if it is done in a way that is too soon and too much, you can hit another huge spike. So we are worried about those who are coming back. Yes, they live here. This is their province. This is our province. This is their province. They are coming back, especially those who are coming back to work. The regulations allow that. And those who are coming back home, who can't go back home, like they defied me when they decided to go back home. They will only be allowed to come back once. In the process, so one of the important things is that we will explain on law enforcement, compliance and testing that we are going to direct our efforts this weekend from midnight. We are ready, I can tell you, from midnight tonight when level 5 transition to level 4, we will be, the interprovincial boundaries and roads will have law enforcement officers who, just to ensure that the people who are coming back is as the regulations need, those who are coming back to work, who can prove they are coming back to work, and those who are coming back home. My home is here. I have family in the countryside, but my home is here. I'm coming back home. The regulations allow that. But the good news is that we are going to do screening and testing on those roads. That's the good news, to protect them and to protect everybody, so that there's no fire that's going to be lit that we can't see. So that's what we're going to do. We are also going to be looking at the sectors of the economy that are open. Retail is a big concern for us. The retail sector can be a source of transmission. We see that in the Western Cape, because we also study what's happening there. Because we are interested, they are our fellow citizens. We are interested in, we are concerned, we are interested in what's happening, what's causing this. And so they've been saying that our counterparts in the Western Cape have been saying the big problem with the retail sector And we're designating that as a hotspot and high-risk sector. All the other sectors that are going to open, there's going to be significant focus on, when we do testing and screening, we are going to be working with the employers to make sure that the firms that are open also put in place these measures that the regulations say they must. And also ensure that where you have high concentration of workers and high risk, we also work with them. We have seen in some of the retail shops like chemists, in other words, pharmacists in our province, they have been hotspots for the increase in the number of cases. So sectors of the economy and sections of the population that are of high risk, we are going to focus on them, because we have also been testing in facilities where the elderly live. We have been screening and testing also in facilities where the most vulnerable, our mental health care users are, because we're concerned about them. Those facilities elsewhere in the world, the elderly homes, can also be places where there can be huge transmission, and the mortality rate can just be driven by that, because that's where you have old people who are living. Having taken a bit of time on the health measures, I want to say briefly that on food security and social relief, we have been able to provide food relief to 52,776 households, not individuals, households. The number of individuals in these households, because the average household in Gauteng is 5 people, the number of individuals who have been able to provide food relief with is 261,375. Just since the lockdown. The big thing is that the demand for food is huge. Even with that effort, it's not enough. We have seen more people, including those who used to work, saying that they need food relief. We are happy that there's been the introduction of the COVID-19 grant. We hope it will assist, that COVID-19 grant will be able to assist. We will continue to work with various sectors, including NGOs, foundations, businesses who are providing food relief, but we want to call for more coordination. Some of the businesses just walk into communities and cause a big problem, long queue or a stampede around food distribution. We are piloting the e-voucher because we want to eliminate this issue of buying food, keeping it in the food banks and then distributing it. That's where problems are. Corruption happens in the process, overpricing happens in the process. So MEC Lesufi, as the acting MEC for social development, is working round the clock to pilot the e-voucher so that those we are supporting with food relief can just get a voucher. They will decide where to buy food and how much at a go, so that we are not involved. There's no big issue. Food distribution in Gauteng, we want to emphasize, is not done by any politicians. No public representatives are distributing food. It's done by officials of the Department of Social Development, and they are doing so working with other officials. So that's all about food distribution. We have also been dealing with an important issue of human settlements. We have identified 3 areas in Tshwane where we are going to do de-densification and resettlement of people. 4 areas in Johannesburg, 5 areas in Ekurhuleni, and then the areas in the West Rand. So I'm sorry they have disrupted me. So we're sharing with you information about how many people will be assisted in those interventions in areas we have identified as needing de-densification for now as part of our COVID response. We're giving you numbers which I won't take you through about the sanitation as well as water tanks distribution. You will see those details. For areas in Gauteng where there's been inadequate water supply, working with our National Department of Water and Sanitation, we've been able to assist these households. Our economic response, let's get to the economic response. We have done modeling, we have done a comprehensive assessment of the impact of COVID-19 on the Gauteng economy. We have looked at data from several sources, global institutions, our own national institutions, including the South African Reserve Bank. We have looked at various sectors which are major drivers of the economy of our province, which sectors will be impacted, how will COVID-19, together with the downgrade, impact on our projections, on employment, on exports, and on our program for integration of those previously excluded from our economy. So we did models. We looked at the best case scenario, that even in the best case scenario, there will be jobs lost. So in the best case scenario for our provincial economy, 250,000 jobs will be lost. And we say to you, that's the best case scenario. It means that the best case scenario is not so good itself. So job losses are inevitable. So in the best case scenario, at least 250,000 jobs will be lost. And the worst case scenario, 500,000 to 600,000 jobs will be lost in the Gauteng economy. And this is a function of, unless certain things are done to mitigate this, so, and where are those certain things going to be done? And we are glad that already the national government, as announced by the President, has put in the socio-economic package to mitigate. Part of it is about social relief, but the other is to mitigate the negative impact of COVID-19 on various sectors of our economy. In other words, to assist various sectors of our economy to be able to continue to operate. So we appreciate that, and as you know, we are the heartbeat of South Africa's economy, so we are working with various sectors to focus on how they can access those that package. But we also know that the SMME and the informal sector, in other words, the township economy, most of the SMME is located in the township economy, and informal businesses will not be able to get that full help. The Minister of Small Business Development was already saying that, she was already saying that yesterday. I read that in the paper today, that that money is not enough. So we want to focus. So whilst we help the mainstream sectors of our economy, the big sectors in services, in manufacturing, to access the national support announced in the package by the President and the Minister of Finance, we want to help for the small businesses in the townships of our province. And it is for that reason that we will be able to share with you what intervention we are making to help those. So I want to share, you would see, there's a slide that shows you how different sectors of the Gauteng economy will be impacted by looking at the two scenarios. The worst case scenario, the shrinking of the economy or the contraction of each sector varies. Food and beverages will contract by 6.6%. in the worst case scenario, but even in the best case scenario, it will still contract by 6%. And you know that integration of food and beverages sector, wholesale and retail will contract by 5% in the worst case scenario, at least by 3%. So we're giving you this to show that every sector of the economy is going to contract. And I think one of the big economic debates is whether, instead, we're no longer concerned whether there'll be a recession or not, the depth of the recession, and whether there will actually be a depression or not, an economic depression of the size that was seen before the Second World War. And we've got to do everything to work with the various sectors of our economy and our national government to address this, including ensuring that we emerge with the new economy, as the President said, an economy that is much more inclusive, sector by sector. So we want to just indicate to you now on this slide, so what are the specific measures? So the first thing we are going to be doing is we will continue to enable SMMEs and township businesses to access the market. Even as we deal with COVID-19, it is absolutely important that what we're buying, even for the healthcare sector, we focus that buying also on what is it that gets produced in our economy, instead of just bringing everything from importing everything, to help boost the sectors of our economy that can produce, that are producing those things that we need now. So access to market is very important, and in Gauteng Province we have what we call a coordinated system of procurement. So whatever needs to be bought by various departments, from sanitizers to masks, various PPE-related stuff, there is a coordination by our provincial treasury to make sure, firstly, that we don't exclude the small businesses from that. We also include the township businesses where they are able to provide what is required on PPE. Of course, many of them would not produce more technologically driven PPE, but they would be able to do some in this regard. So that's a decision we have taken as the Provincial Executive Council. So it's important what we buy, where it is produced. Yes, we want to bring other stuff that's not made in our economy, because this is about saving life, but that stuff that our economy is able to make is important. So we are coordinating this approach. So this issue around access to markets, it's very, very important, including the government's buying power, and in support of the local industries. And I said SMMEs and township businesses, but on more advanced equipment, including the ventilators, on more advanced equipment that can be produced also in our economy. We also want to encourage those sectors of our economy and the firms in our economy, advanced manufacturing firms, to be encouraged to be able to produce that as part of our reindustrialization effort. Then there's access to finance. So access to markets is important through procurement. And I want to also say that we also want the cooperatives that are producing school uniforms. We buy school uniforms for our schools. Every year we buy dignity packs. Those cooperatives, we want them also to be able to produce the masks, the face cloth masks. That we are going to need those for our children going back to school. As and when they go back to school, they will be needed, and various employees of government who are not the healthcare workers or the police, those who must not wear the surgical masks, They would need the face mask, the cloth one, where government has to procure for sectors such as the elderly or the children. We want to encourage that government buys from our cooperatives that are part of the businesses operating in our communities. At the moment, they are grounded. I want to say access to finance. We have been working with, in collaboration with the South African SME Fund, which was, as you may know, it was established by the CEO initiative 2-3 years ago. We have been working with the South African SME Fund, and we have finally reached an agreement with them that together with them, and provincial government will identify in its reprioritized resources a small amount of money we can put on the table. But the SME Fund, the South African SME Fund, will put a huge kitty of its SME funding. So the total amount we will have will start with R1 billion, 1 billion rand. And I want to say this 1 billion rand is to enable SMMEs in the townships in particular that are, some of them are open. They are supposed to be operating as part of level 4, but they don't have enough credit to be able, because there was a shutdown at level 5. Many of them can't even as we open now, they have great difficulty about how are they going to cope. So they will, this 1 billion Gauteng specific partnership fund, we call it the Gauteng SMME Partnership Fund. This 1 billion, most of this money is going to come from the South African SME Fund, not MME, SME Fund. This will be a key factor in helping the businesses, small businesses in our province to return to some measure of normality as part of level 4, to be able to continue employing people, to be able to procure the goods and services that they need to operate, and to be able to pay rent where they are supposed to pay rent. And included in this, what we call SMMEs, included in this are also creatives. Creatives, individuals in the creative industry are businesses. Those, it may be a one-person business, an artist, someone who was running a sports club, which can't operate, faces difficult. So in the creative industries, in the SMME sector, in the townships, they are included as those people who will benefit from this fund. So this fund will operate through a platform that is an ICT platform. It has already, this platform already has 500 firms, local businesses. We know we will launch it next week, basically. We know that half the time technology can be used to exclude those who don't use it. We want to help all the SMMEs and the township businesses in Gauteng to have access to this fund through the platform that we have set up. So we will do the joint launch next week together with the SME Fund, the South African SME Fund. We will launch it next week here at Nazareth. And I think what we also show, we will share with you what it will look like. I don't have the time to do that now. I want to deal with the law enforcement for level 4. So this is what I was saying to you earlier. So the daily roadblocks on provincial roads, on national roads will continue during level 4 because the regulation says no inter-provincial movement. It is limited except to those we have mentioned. And no movement is still limited unless when you are going to work in the sector that is open, or you are going to buy food or that. So we will continue. These roadblocks that you have seen, and we are saying even on national roads into Gauteng province will continue. I've said to you already that as of midnight, our public health officials and law enforcement will be on the roads, the inter-provincial roads and national roads into Gauteng, Limpopo, into Gauteng, Northwest into Gauteng, Free State into Gauteng, Eastern Cape into Gauteng, Mpumalanga into Gauteng, KZN into Gauteng. So there'll be screening on those roads and testing that will be done by our health officials. And the reason is something I advanced earlier on. I want to conclude by saying that we have worked. We want to thank the businesses, the donors, the NGOs, community action groups that have been doing amazing work of relief, social relief, to help in some communities, to help the elderly, to go and assist them with buying food they need, but also to provide food to those who are not able to get food. So we want to thank them, and I have a long list of businesses that have done wonderful work. We have been meeting with these businesses. Some of the foundations, the major foundations in our country, have also been doing great work. We want to thank them for the work they have done, and the NGOs that have been doing amazing work. Many of them have worked with MEC Masuku. Some of the businesses are helping us to procure PPE, personal protective equipment. Some are even sponsoring the infrastructure, like the NASREC infrastructure. We have lots of business support as the provincial government to set up that field quarantine and hospital there at NASREC. There are also those that have been providing food at our food banks. We want to thank them. They've worked with MEC Lesufi, but the road ahead is tough. I want to conclude on the note that the level 5 of the lockdown is something we have learned major lessons about. We are going to level 4, but the road to the new normal is very long. We still don't know how we will be impacted by the pandemic, the next phases of the development of the pandemic, and I want to say we will not be complacent. We must not think this has passed. We must not think this has been exaggerated. There's lots of fake news and stories and articles and videos being circulated there to say COVID-19 is a sham, and we are not working on that basis. So far, we have reduced the level of infections, but the road ahead is still far. The rate of mortality is low in our province, but the road ahead is still very, very far. And I want to continue to call for more social distancing. All of us needs to internalize this social distancing as a norm. Sanitization, workplaces.
Dr. Mkhize, he also gave a clearer indication of how the country and different provinces would move between the different levels of the lockdown.
The lifting of the